Mayor Lee, members of the council, Brian Holloway, Holloway Land Company, representing the foundation and CNU Hospital. Really don't have a presentation for you tonight. Really, this is a council's action. The issue before you is there a public benefit to the city of having a hospital in the jurisdiction. That's really what the TEFRA hearing is about, is for you to make a determine yes or no, is there a public benefit, just like you've looked at the public benefit of affordable housing and low-income housing and other projects before you. A couple things that have popped up tonight I'd like to respond to, and that is why now? Why are you requesting this financing now, this TEFRA hearing? And it's commonly done, for one. Two, one of the issues is that the community has said, where is your financing? You've heard that tonight. And so we're working on our financing instead of waiting till the project is approved and then going forward and looking for financing. The idea is to have financing, doing our financing explorations and operations and options now while the project is going through the process of your consideration for approval. Nesta said, where's the financing? Consistently said that, and we're saying this is one option that we think makes a lot of sense. It's commonly done. It's less expensive, and it allows a hospital that ought to be nonprofit provide additional resources to the community, especially those members of Elk Grove, residents of Elk Grove, who have trouble paying insurance premiums and co-pays and things like that. So the other question has been, why the nonprofit? Why the change to the nonprofit? Well, nonprofit is required for TEFRA financing. The prior entity that you've heard about tonight several times was a nonprofit for the pharmacy school, and it had a much narrower purpose. So this particular nonprofit, which would allow the TEFRA financing, is done to allow for serve the community better, to include a hospital far beyond what the pharmacy did, a hospital, research, and health services, and to serve the community in a much more comprehensive way. The other question that came up is, that I've heard, is that will the state hear this hearing? Should you go forward? Will they hear the project and make a decision? My understanding is that if your decision was positive tonight, that the board, the California State Finance Board, would hear it at their next meeting and make a determination. So just one thing I did want to mention is there's been some comments that there's not been much neighborhood outreach, and I just wanted to give you a quick update that we have met with the leadership of Nest. We've had a very cordial conversation with the new leadership. They even toured me around the neighborhood and showed me their concerns on the property. We've scheduled a meeting with the leadership of the Stone Lake HOA. That's coming up next week. We've established an informal website and put ads in the paper alerting the neighborhood to that website, which is interactive. It allows the residents of this community to ask questions. Thank you, sir.
Okay. Oh, you have a question? Go ahead.
Will you be able to speak on why you went from profit to nonprofit, or will one of the other representatives from CNU or the foundation be able to speak on that?
I can speak to that. It's very simple. You need to have a nonprofit in order to go forward with tax-exempt financing for this project.
No, I understand that, but the difference between profit and nonprofit, what is the cost differential to the project?
The cost differential is the tax-exempt financing, which means that the financing is less expensive for the operator of the hospital. And so that allows, rather than dollars to go into profit, one, it's less expensive, and two, instead of extra dollars that may occur, those would be used for the community benefit rather than the benefit of investors.
And what do you know typically what the spread between a profit loan and a nonprofit loan on these bonds are?
It depends where the economy is. I don't happen to know what the difference would be today.